Hello, welcome to a practice management short from MedChi, the Maryland State Medical Society. Today, we're going to be talking about how to make your practice more profitable. I'm Gene Ransom, the CEO of MedChi, and I'm here with Kate Gillman from Medical Business Partners. And Kate could not be a better person to be discussing the profitability of physician practices. She has over 20 years experience in the healthcare industry. She's an expert coder, compliance officer. She trains physicians all over the country. She utilizes her skills and abilities to improve billing, coding inefficiencies, training staff, ensuring compliance, and really focusing on maximizing revenue. Kate and her partner, Julia, work closely with MedChi and MedChi practices, trying to make sure that physicians can run everything well. And one of the things I wanted to point out was if you're in private practice, MedChi has a Center for the Private Practice of Medicine that you can access on MedChi's website at www.medchi.org. There's all kinds of information on different services from practice management to technology, finance, insurance, whatever you need. And really what we want to do today is have a discussion about the physician who wants to make their practice more profitable. And if I've got one of these docs who's been kind of doing the private practice thing and running on the treadmill, and they kind of wake up and say, you know what, I really want to grow and expand my practice. I'd like to see us making a little more money. Kate, can you let us know what should that physician do? What should the doc do? Should she reach out to you? What should she do to kind of take that first step towards increasing and growing and expanding their practice?
Sure. So they should definitely start thinking about reaching out to their CPAs and their financial advisors first to see where they are and whether they are in the position to invest in expansion. And then depending on how they envision the growth, we could definitely talk and figure out the space to discuss further steps and start developing the plan and infrastructure. If for now, for instance, they're having some difficulties with coming up with the right cash flow and there's some inefficiencies, I would definitely recommend to do billing analysis. I would definitely recommend to review the current payer contracts to see where they are and if anything can be improved to increase the revenue and potentially to find ways to get payers to pay more money for the services performed.
Right. So obviously, if they're in a position to invest and things are going well, that's one discussion. But some of these things, and we have the 4 bullets here: billing analysis, payer negotiations, credentialing, coding review, and education. Those are things they can do at actually a very reasonable rate to really look and see where they are and make changes without maybe really expanding or adding staff or adding practitioners. So why don't we talk about those 4 things and how they work and what they are? So maybe give us an overview. What's a billing analysis, and why would that be valuable in figuring out how to make your practice more profitable?
It's extremely important to understand your current billing processes just to make sure that there's a consistent cash flow, that there's no loss in revenue, and then the billing team assisting in collecting on your behalf from patients and payers are doing a great job. Allowing a third party to do analysis would give you a better understanding if everything is going great or if some minor changes need to be put in place. There's no need to outsource the in-house team or bring the billing team in-house instead of outsourcing. Sometimes it's just helpful to hire a consultant who can analyze the current setup and offer solutions, either additional training to the team or alternative way on how the claim should be followed up on, and maybe suggesting adding a new staff. Billing analysis should just be a review of some of the reports, and the report names are provided. And then based on those analysis, you would know what needs to be done to improve or just continue doing what you're doing.
And obviously, a billing analysis is probably something that even an established practice that's run pretty well should consider doing every so often, because you never know what you might find out. you might find that maybe you're not getting paid on a certain code, or maybe your collection process could be updated, and it just makes a lot of sense to do that. The other thing that you should probably do on a regular basis is look at those contracts you have with the payers. So talk a little bit about contract negotiation and how that works and how that can help make a practice more profitable.
Many practices, regardless of their size, might not be aware or even think about that being an option to negotiate current participation contracts they have in place with commercial payers. Any specialty you should be able to negotiate. What they should do is run reports out of their billing system to identify top payers and what they get reimbursed by each payer in comparison to a Medicare fee schedule in their state. There's a whole list of reports that can help identify that information. Once that is done and the top 5 are identified, then the practice should look for current contracts with those payers to see if it's time to renegotiate the rates. There's so many factors that can contribute to fee increase requests. There's inflation, there's cost of living increase. Practitioners are saving payers money by keeping their patients away from the hospital and expensive surgeries. So as long as the practice knows how to properly place themselves and establish their leverage in a healthcare space, there's no reason why they shouldn't get paid more money by payers for the services they offer. And this is definitely something that we can help them with.
All right. So on credentialing, a lot of times we think credentialing is when you're setting the practice up. So why is credentialing something that a existing practice should think about?
So there's always a re-credentialing process. Most payers, they require every 3 years to re-credential. And then there's always additional information if the practice adds new providers, if the practice removes practitioners from their practice. And so it's extremely important to have a good and established relationship with the credentialing team that can help you with that. There's a portal for the CAQH where practitioners keep all of their information, their medical license, all of their malpractice insurance information, and commercial payers periodically check to make sure that everything is up to date. So you want to have someone who constantly monitors and maintains that information, someone attests on your behalf on CAQH profile every 120 days. And then if there's any additional information that needs to be provided to other payers, then you have someone with experience who can help you with it.
All right, and last but not least on our list here, and obviously there are a lot of other things that medical business partners or MedChi can offer to help with regards to making your practice more profitable. But we highlighted coding review and education. Why is coding review, and I know one of the things you do occasionally are coding audits. Why is that important with regards to making your practice more profitable?
Properly reporting services to payers will help practices maintain cash flow. It will help reduce the risk of denials and stay compliant with current federal regulations. There are always new updates to documentation requirements and medical necessity for specific services. The time requirements, for example, for evaluation and management services are changing, or they were changed in 2021 for some codes, then they were added for additional codes in 2023. There's so much going on, and there's no time for medical practitioners to invest their time into this and research this information. They want to concentrate on practicing medicine. So having an outside coder to take a look at the notes doesn't have to be a lot, maybe 10 charts per practitioner, just to get a better picture of whether you're doing a good job or if you need to modify some templates, or maybe you could be coding for a higher level of service. So there is an opportunity without really changing your workflow and getting paid more money for it. Because according to OIG, undercoding is as bad as overcoding. So please keep that in mind and make sure that your coding review is up to date.
Well, thank you so much today for spending some time with us. And I think if we have any practices out there that really would like to help consider making themselves more profitable or kind of crossing those I's and dotting those T's so things go well, they can reach out to MedChi. Our website is www.medchi.org. And we can connect you with Kate or somebody else who can help you out. Kate, thanks for spending some time with us today.
Thank you.